Today I'm going to talk about dislocated shoulder. So what is dislocated shoulder? Basically, the shoulder joint is called a ball and socket joint. The proximal head of humerus is popped out of the socket that connects to the shoulder blade. The socket is also called glenoid. What will affect this injury? There are 3 bones and 3 joints will affect it. The 3 bones are scapula, humerus, and clavicle. The 3 joints are glenohumeral joint, acromioclavicular joint, and sternoclavicular joint. The 3 bones are joined together by ligaments, tendons, muscles, and joints. So there are 4 symptoms in this injury. The first is pain. Second is swelling and bruising. The third is shoulder will be deformed and numb. The pain will usually occur in your upper arm and shoulder. This will affect your movement of shoulder. Sports is one of the causes of injury. This will usually happen on teens in their 20s because they are the ones who contact sports the most. Sports injuries such as football, hockey, downhill skiing, gymnastics, and volleyball. Fall is also one of the cause of injury. You may dislocate your shoulder during a fall, such as fall from a ladder or from tripping. Last but not least, accidents like motorbike accident, car accident, and in bike race marathon will cause this injury too. All these causes of injury takes a strong force to pull the bones. All these causes of injury takes a strong force to pull the bones out of place. Complication of dislocated shoulder. There will be tears of muscles, ligaments, and tendons that connect to your shoulder joint. Blood vessels and nerve will be damaged in and around your shoulder joint. Shoulder instability will occur. Shoulder instability, which means you might have dislocation again in the future. There are 2 ways to treat this injury, which is medical way and surgical way. In the medical way, patients have to rest their shoulder in a sling for 1 to 2 weeks. X-rays will be needed to determine bone injury. Physiotherapy exercise is needed too. This is to strengthen the shoulder muscles. In the surgical way, doctor will reattach torn ligament tissue to shorten the stretched ligament tissue. The arm has to be kept in a sling for 4 to 6 weeks. Physical therapy is needed to regain motion and strength. There will be 4 phases to full recovery. In phase 1, which is maximal protection, your arm will be in a sling and you will need an assistant to complete daily tasks, such as bathing. Physical therapists will teach you strengthening exercises to reduce pain and use cold compression or electric stimulation to relieve pain. In phase 2, which is moderate protection, you will reduce the use of your sling, and your strengthening exercises will be more challenging. Exercises like strengthening of shoulder blade, which is your scapula, and rotator cuff muscles will be added. Those are the muscles that provide stability to your shoulder. At this phase, you must avoid heavy lifting with your arms. In phase 3, you can do more challenging movements. This phase will begin 3 months after surgery. You should have full use of your arms in daily activities, but not in activities such as sports or work. Physical therapists will be adding much more difficult exercises by adding more weights into your exercises. In phase 4, you can return to daily routines and sports. This phase will be 4 months later. Physical therapists will have you in specific exercises to meet your needs. It may contain practice in lifting heavier items onto shelves, or housework, and maybe more intense workout. Shoulder brace is needed to allow you to recover safely without being injured again. For the physiotherapy exercises, I would recommend shoulder flexion. First, lie your back on a flat surface, and then hold a one with your hands and palms facing down. Place your hands slightly wider than your shoulders. Keep your elbows straight and raise your arms over your head slowly until you feel a stretch in your shoulders, upper back, and chest. Hold it there for 15 to 30 seconds. Repeat all these steps for 2 to 4 times. Next is shoulder blade squeeze. Place your arms at your sides, squeeze your shoulder blades together, and do not raise your shoulders while squeezing. Hold it for 6 seconds and repeat this exercise for 8 to 12 times. The next exercise is internal rotator strengthening exercise. Note that this exercise will need an elastic exercise material. Tie a piece of elastic exercise material to a doorknob. Bend your elbow in a 90 degrees L shape at your side. Shoulder must be relaxed. Place a roll towel between your elbow and your body and squeeze it. This will help keep your arm at your side. Hold one end of the elastic band in the hand of the injured arm. Rotate your forearm towards your body until it touches your belly. Repeat this exercise for 8 to 12 times. The last exercise I would recommend is wall push-ups. Stand against a wall with your feet 12 to 24 inches away from the wall. Feel free to stand closer to the wall according to your flexibility and work your way up. Place your hands on the wall slightly wider than your shoulders and lean forward. Lean your body to the wall and then straighten your elbow to get back to the original position. Repeat this for 8 to 12 times. And these are my references for this webinar.